Start with this. It's a cholera outbreak in Hammanskraal that has so far claimed 10 lives. The City of Tshwane advising people not to drink tap water. Now, that is only one part of a solution. The question is, how did this happen? Because residents have been complaining about water quality in the area for years. It's a story we've been covering for years as well. Let's find out what the plans are and also what the status is at the moment. I'm joined by Tshwane Mayor Cilliers Brink joining us. Mayor, good morning to you. I appreciate your time. I see a 3-year-old child is amongst one of those who succumbed to this cholera outbreak. Where are we? Why are we not on top of this? Good morning.
Good morning, Gareth. Yes, this is absolutely horrifying, and the first priority of the City of Tshwane in cooperating with the Gauteng Health Department is firstly to determine what the cause of this cholera outbreak is, but secondly to save as many lives as possible, both by treatment and the prevention of the spread of the cholera disease. As you mentioned in the introduction, there has been a major issue with Hammanskraal water, the Mayoral wastewater treatment plant, for a number of years, in fact, almost 2 decades. We've been very candid about the fact that there are problems at that plant and that we require the assistance of national government to resolve that once and for all. Successive administrations in the City of Tshwane have not done what should have been done in these circumstances. But I do want to stress that we haven't yet confirmed the cause of this outbreak, and to jump to conclusions now would be a mistake, in part because we actually need to stop whatever the source is of this, and if we misdiagnose or if we decide prematurely, we might in fact be disadvantaging public health.
Yeah, it's almost a triage situation, isn't it, Mayor Brink, at the moment as well? While you're trying to figure out what's happening at the water treatment plant, I'll circle back around there at the moment. What is the deal and what is the story with the Gauteng Health MEC? How are you working together to try and get on top of this? Obviously, you are the mayor, but Gauteng Health needs to be involved here as well. Give me a sense of conversations between you two. How open is the dialogue?
Absolutely. The member of the Mayoral Committee for Health, Rena Marks, has been with the MEC for Health in Gauteng at the Jubilee Hospital. She was there on Saturday. She was there for most of the day on Sunday. There are health workers from the city assisting the province. We've also deployed social workers to assist the families who have been affected by deaths from this incident. Whatever support Tshwane can give in terms of health assistance, health workers' expertise, we've offered that. We will also give our full cooperation in any tests that need to be done. So there are routine tests done in the water sources of Tshwane. The past routine water tests have not revealed cholera, any positive cholera tests, but additional tests have now been done, also on water tankers provided to the communities affected by the area that does not have potable water. Those results should come in as soon as possible, and based on that, we will announce further action.
So, as has been reported, Mayor, 10 people having lost their lives. Give me a sense of the numbers you understand of the number of people who've been infected as well. Thankfully, although tragically, only 10, but I'm seeing reports that it's quite a bit more than that. What's the numbers you're hearing of infections?
So infections to date as a total is about 100. So there's been an overflow at the Jubilee Hospital, and patients have been also sent to Steve Biko, George Mukari, and other provincial hospitals. The MEC for Health has also announced that additional wards would be made available. I think these are wards that were used with the COVID pandemic in order to treat the patients and to make sure that nobody is left untreated. But it's very important that if there are diarrheal symptoms of people in the area, that they get to health services as soon as possible. The city has also given directions to warn once again that large parts of Hammanskraal does not have potable water, and so water tankers are provided. In the instances where tap water is used, there is a specific treatment that must be done to that water before it can be used for cooking or purposes, anything related to food. And of course, we also urge people not to bathe in natural water sources, and this includes baptisms and the like, because that also creates the risk of a cholera spread.
I see reports coming out, Mayor, that Denosa says the City of Tshwane itself is to be held responsible for the deaths in Hammanskraal, and they want an inquiry into this. What's your response to Denosa this morning, saying it's the city that has resulted in 10 people being killed?
So, once again, we must wait for the results of various tests done on water sources before we jump to conclusions. If the City of Tshwane is responsible, we must take responsibility for that. We know that the water situation in Hammanskraal is not what it should be, but to make pronouncements of that nature before we have the facts, I think would be a mistake. Also because, as I mentioned, if indeed this is not the City of Tshwane, if there's some other source, and we prematurely decide that it is Tshwane, then we might not in fact contain the source. Let me also just mention that one of the communities affected by the outbreak is the area around Carousel, which is not supplied by the City of Tshwane with water. It's supplied by Mayoral Water, an entity of the Department of Water. And so that complicates to get the test results before we lay blame.
Just before I start saying goodbye to you, Mayor, so what is the advice at the moment? We're telling people to boil their water before they drink it, but let's be honest, in many of these areas, I'm sure you'll agree, either that the boiling of water is going to cost money for gas cookers. Not everybody can afford that. The other problem, of course, as we all know, is the blackouts. People aren't able to boil their water. Where are we on water tankers? Where are we on fresh drinking water for these areas?
So to formalized areas in the Temba area that's affected by the malfunctioning of this water treatment plant, there are daily water tankers provided. We are working with officials on the ground to ensure that those water tankers are in fact doing their work, that the contractors are meeting their obligations. In informal settlements around the area, there was an infrequent 3 days a week provision of water tankers. That has now been extended to 5 days a week. So the city is providing water to areas that does not have potable water. I would give the additional advice to clean all water containers, households that use water containers, to clean those water containers with household bleach to make sure that those containers are also clean, because there's also the risk of contamination. And then in addition, what I've already said about staying away from rivers, streams, and natural water sources.